20 years ago, Dr. Rachel Brem saw a problem in her breast imaging practice she couldn't ignore. Women slipping through the cracks, not for lack of solutions, but for lack of access. In 2006, that realization sparked something bigger.
Brem Foundation started when 4 friends found out women who needed financial assistance to receive necessary diagnostic procedures that they otherwise could not afford. And we decided that it would be a great way for us to help women in need.
In Washington, D.C., where breast cancer death rates remain among the highest in the nation, that decision became action. That year, Brem Foundation established the Biopsy Fund, ensuring costs would never stand in the way of care.
There were 13 patients of Dr. Brem's that needed additional testing. So that began the process. Okay, if we save one woman from having an unnecessary mastectomy, we can do this.
What started with a small group quickly became a movement.
Everybody knows the pink ribbon, but not everybody knows that you can have breast cancer and still have a normal mammogram, that you need additional testing, that you must advocate for yourself. Knowledge is power, and that's really a fundamental principle of the Brem Foundation. It's what drives us.
But knowledge alone isn't enough. Access is everything. In 2019, Brem created Wheels for Women, the first program of its kind to provide free transportation to and from breast screening and diagnostic exams.
The Brem Foundation's Wheel for Women program has had a huge impact in our community. The population that we serve generally moves with public transportation, and oftentimes public transportation is not very reliable. Now, more women are able to access healthcare, going to the imaging facilities, getting screening exams, early detection.
Today, Brem Foundation is focused on one thing: early detection.
We work to educate women, we work to open access to early detection services, and we advocate for meaningful policy change.
The death rate from breast cancer has gone down by more than 50%, but we still lose over 45,000 women in the United States alone.
The mortality rates for Black women are 40% higher than white women, which is unacceptable and must be addressed.
Too many women are still being left behind.
There's been a 71% increase in the death rate in cancer in people under 40, that we don't have a solution on how to screen, and the Brem Foundation is working on that.
Many women just don't know that they really need to self-advocate. We need to reach more women, and we need to save lives.
So Brem meets women where they are.
Hosting a Brem event at Eagle Bank really created a sense of community. It opened up a conversation for people to feel more empowered, to have real honest conversations with their doctors, their family, and friends.
And expands its reach through tools designed to meet women in real life.
We have a really fantastic risk assessment tool on our website called CheckMate so that women can understand what their risk is and get more information about optimal screening.
Including a Spanish language version developed with community partners.
In creating the Spanish version of CheckMate, we not only looked, at the language, but we were also looking at the cultural concepts behind it.
Brem pushes for change where it matters most.
One of the Brem Foundation's major legislative priorities is the Find It Early Act, a bill that will remove all copays and deductibles for all screening, diagnostic, and adjunct testing.
What started out as an organization that was very, very regional is now growing to a national impact. And the amount of people that we're helping is immeasurable.
The next 20 years demand more. The opportunity to make an impact is greater than ever.
We have 3 times the number of requests for our programs that we can support today.
Brem envisions a future where every person has access to the highest standard of breast cancer diagnosis. We're setting out to prove what is possible when early detection is no longer a privilege, but a guarantee.
Your support makes it possible for Brem Foundation to engage in life-saving education work, to break down access barriers in underserved communities, and to advocate for meaningful policy change that will save lives.
Invest in access, invest in education, invest in advocacy, invest in saving lives. Join us, give boldly, and help power the next 20 years of early detection.
Detect early.
Detect early.
La detección temprana
Save lives.
Salva vidas.
Save lives.
The next 20 years starts here.